when did NCDC start working without the cooperation of the State Ministry of Health? We have a squadron committee. We have a State Ministry of Health. They were not contacted before the man was brought through the back door to Abuja and the declaration was made. So these are clear violations of even the protocols set by the NCDC itself. We've also had conversation with the son of the man, and he told us all the things that transpired. It is all fraud, and it is not going to be accepted by the state government. I am not one of those who think NCDC is helping this country. I am one of those who think NCDC has an agenda to spread COVID-19 to all the states of the Federation. And when there was no case in Kogi State, they did all they could to ensure that Kogi has a case. They are locking down the country. They are advising the presidency to lock down the country. The economy is suffering. The economy is bleeding. People are hungry. Other ailments are killing Nigerians. Why they are concentrating on a pandemic that has killed less people than malaria has killed in the last 2 months.
There were a series of questions on Kogi. My Honorable Minister was in touch with His Excellency over the last couple of days. I think everybody is working very hard to resolve this issue. There's actually no dilemma in the two cases. They followed absolutely normal practice. These were a patient that was referred from the Federal Medical Center to the National Hospital. This is a normal referral pathway when you have a case. The physicians in the National Hospital, I don't have any influence over the work that they do. They suspected COVID-19 based on the clinical symptoms of the patient. Did it ask for a test? The test came out positive. The individual lives in Kogi State. Everybody's in what we do in public health. Your public health response is based on where you live, because that's where your contacts are. So this is not controversial in any way. Standard practice was followed. Once the results came out, the state epidemiologist was informed that he has to do contact tracing around this patient. It is the state's responsibility to do that contact tracing. So we hope they do it. There's nothing actually controversial in any way about this. It's all standard, fairly standard practice. They asked whether we want to subject our test for validation. You know, we're a public service organization. Everything we do is open to the Nigerian people. The last time there was some question about the test of the patient from Benue. We were asked to send it to NIMA. We sent it to NIMA. They got exactly the same result as we got.